Well, hello, everybody. Welcome to our very first live webinar. I'm excited about this, but I will tell you this is just a little bit strange for me. I don't have your smiling faces sitting in front of me. And so I am just going to imagine that you are laughing at my every joke, listening with bated breath, and are very interested. So and drawing from your collective cyber energy that you're sending my way. So anyway, we're going to talk about group counseling mechanics for chemical dependence today. Just wanted to do a little bit of house cleaning. I did like a little practice thing attending with my own cell phone, and I have a cell phone that's actually an iPhone, and so what I noticed was I could either see the slides or my video, and then I found I could just swipe one way or the other, and it allowed me to go between the actual slides and the video. So I thought that might be useful to you. I think on all the other mediums, you should be able to see both. And then in regards to questions, so on the right-hand side of your screen, you should see a hand there somewhere. And that hand, if you hit that, that's like raising your hand. So if you raise your hand, I will then see that you've raised your hand, and then I can actually activate your microphone so that you can ask your question for all of us to hear. That's my preference on doing this. If whatever equipment that you're using doesn't have a microphone, then I will go ahead and answer them on the screen if you type them in here, but I'm trying to avoid having you guys tolerate me going like this trying to read your question. Okay, so that's the way we'd like to do the questions. And then at the end of the survey, or at the end of the webinar, you're going to be sent automatically a survey that has both the survey about the webinar and it's got the post test on there. And so it's actually a 5-point thing, and I was only able to create one actual survey. So it has both the surveys and the post test, and this just makes it easier for everyone. And so you'll notice that the post test questions are 5 true, false, and right there on the question it says that 1 equals true and 2 equals false. So it should be very easy. And then you just hit submit, and then I go and capture that stuff, and then from that list I create your certificate. So make sure that you do those. And then at the end of this, you'll have my my email address too if you need to contact me for anything. So I think that's it. So let me go ahead and get started with this. So one thing that I want to just share with you that and actually in one of my videos, I think I tell this little spiel. I was really attracted to this profession by what happened in my groups when I was in treatment. A guy by the name of Jim Fulton, the late great Jim Fulton, who was my mentor and actually a past KDAC president, he was my counselor, and I was just really amazed at what he was able to do in that group. And one thing was he was just able to like really kind of hold me up for me to see and do it in a way that I was able to see it and receive it. And he was able to confront my behaviors without, hurting me. And that was a really valuable thing that I received in group. And then the other thing was that he seemed to make the group safe enough to share and to really open up. Because when I first got there, it's like, I'm not sharing anything with you strangers. But like within a few short days, I really felt like I could do that. And it was really because of the environment that he set up there. So, and then the next thing before we actually go into the meat of this is that I'm drawing from my own experience of doing groups for over a decade. And then also in my management positions, I've actually audited many groups. I've done a ton of group evaluations, and I've seen a lot of different styles and a lot of different ways of doing group, some of which are very effective, others not so much. So I've learned a lot from that, and I hope to give this information to you today in a way that will really help you increase the efficiency and efficacy of your chemical dependence groups, and maybe help you develop a clearer role of your your role in the group, and at least it's this one counselor slash supervisor's take. And then also, I will kind of end with talking about how you use the groups to help clients learn how to feel and experience uncomfortable emotion. That's actually something that is hugely important. And those of you who are familiar with my work realize, that I teach about coping with emotions, and that's really based on the idea that if alcoholics and addicts run from uncomfortable emotion by drinking and using, then perhaps the most important thing for us to provide in our groups is teaching our clients with the tools of recovery that they can actually feel and experience uncomfortable emotion without using, and let them see how they've done that, which is with a sober support system within the group. And we'll get into that a little bit later. So let's just talk a little bit first here about benefits of group as opposed to one-on-one. You may be familiar with the TIP 41 series that SAMHSA put out, and they have it's TIP 41 is what I'm referencing here, and they referenced a research study called Project Match. And in this study, this statement was found there, which group therapy and addiction treatment are natural allies. The reason is that people who abuse substances are often more likely to remain abstinent and committed to recovery when treatment is provided in groups. So this is telling us that people are more likely to remain sober by doing groups as opposed to one-on-one, and they're more committed to recovery. They're more connected to recovery. And it goes on to say that this capacity of group therapy, although let's be careful about this term therapy, we as alcohol and drug counselors don't really do group therapy. That's beyond our scope of practice. So we'll use group therapy and group process interchangeably here. The capacity of group therapy to bond patients to treatment is an important asset because the greater amount, quantity, and duration of treatment, the better the client's prognosis. So if we're doing group, we're increasing their ability to stay sober, we're increasing their attentiveness level, which keeps them coming back, and the longer they're with us, the better the outcome. So let's talk a little bit about, like, what are the things that really draw people in and get them connected to their group. So one thing is that, when we're in group, all the group members get to see what's happening. Whereas, like in a one-on-one, it's just you and the other client. They're not being able to see work being done with other folks. In group, when the work is being done, they're seeing the problem-solving activity happening. And remember, our job as counselors is to really work ourselves out of a job with our client, right? So we want them to be self-sufficient and not need us anymore. And so we want to teach them problem-solving skills. And in this group context, they get to see people actually utilizing these problem-solving skills and learning how to do it. And they're seeing the counselor helping them with it. They're seeing the support from other peers and helping them solve these problems as well. So I'm assuming that my video is working okay, and if it's not, maybe all of you raise your hand at once, and that will tell me, uh-oh. Okay, so the next thing is empower group members by encouraging them to offer assistance and feedback to other members. So we're basically, the folks in the group, we really want them to be participating. We want them providing feedback and assistance to others. And there's one thing that's super valuable about this as well, is not only being able to receive feedback from their peers, which provides validation. They're getting this from people who really understand what we go through as alcoholics and addicts. But it also, the person giving the feedback, it gives them a sense of like utility, if you will, right? They feel useful. Many folks who come to our treatment programs feel sometimes useless, and they have a lot of shame issues and trauma, and so they've maybe chased people away out of their life, and people maybe don't want to have much to do with them. but now they're in a group situation where they're actually able to help other people, and it brings the self-esteem up a little bit, and it provides a good feeling when they're talking, and actually people are receiving their feedback. That's a really great thing for people to be able to experience. And then teaching healthy coping skills to manage daily stressors. So this is what I was talking about earlier, that we're teaching clients coping skills, mostly in our psychoeducational groups, but also, in our process groups, which we'll talk a little bit more about later. But one of the big things about treatment is, if clients use because of their stress and other uncomfortable feelings, we need to teach them how to actually use the tools of recovery to be able to not use, so that they can just feel. And being able to feel and verbalize feelings in a safe environment is another thing, and being able to be received and receive that empathy and be with people who are willing to sit in their pain with them. That's another thing that really draws people in and gets them connected to the group, because they may not have experienced that ever, and if not, maybe for years. And then there's this relationship that happens between clients when they're sharing their innermost thoughts and secrets, and really being vulnerable in the group, and still being able to be accepted by these folks. There's this bond that happens like none I ever experienced before I got into that environment, where people are really, they really feel the connection. And there's a couple really important parts about this. One is that they feel this connection, and these people in the group, at least those who are really taking sobriety seriously and are going to be going to meetings outside and really working a program, this can be like a base of their support system, like an initial base. But the other thing is that through that process, they get to see that they actually have the ability to build that sober support, right? So they might not think that they're even capable of this, but they're going to the same group, they're seeing the same people, they're developing these relationships, and this gives them the understanding that they actually do have the ability to build these kinds of relationships and to build a connection that maybe they take outside of the group, so that when they're done with their primary care, and they're going to their meetings, that they have the confidence that if they go to the same meetings, that the same kind of process will happen out there that happened here. And we really do want to point this aspect out to our group members, that they do have this ability. You see the connection that you have with this group? Well, that's possible for you out there in those community support meetings. And so we know you can do it here. How did you do that? Well, you just kept coming here, you're seeing these same people, you're sharing your stuff with them, you're bonding. Well, that same model is something that you want to be able to develop out there. And if they're like in an ILP program or in aftercare, we can see how that's going and help that part blossom. And then the other thing about group is, we get to use our therapeutic tools, like, challenging, irrational beliefs and confronting poor decision making, to modify how they act, and that everybody in the group gets to see that process. And we can use our cognitive behavioral therapy skills and our relapse prevention, and it's not like we're doing it just with one person. And one thing that I really want to bring up is, if we structure our groups correctly, and I think this should be verbalized as we're structuring the group, is letting the clients know that that we really that if it may seem like only a few people are doing the work, there may be like only, let's say you have a group of 12, maybe there's 4 or 5 or 6 of them that are really doing some good down and dirty work in the group. That's actually my preference, is to do it that way, rather than having each person share for 5 minutes, and no feedback. I mean, that's like a 12-step meeting. That's not what we do. This is not a 12-step meeting. We want people to really dig deep and get into their stuff. And so let's just say there's only 5 or 6 people that actually do that deep sharing. Well, we want to let our group members know that even though it seems like they're the ones doing the work, if we're doing group correctly, you're applying what's happening in there into your own life, and how does this apply to you, and what feelings are you experiencing as these others are doing the work. So everybody should be doing the work while it appears that only a few are doing it. I hope that makes sense. So also in the tip 21, and by the way, please feel free to ask questions during this. I'm really actually counting on questions because I left a good amount of room in this talk for to be able to go ahead and answer questions. So if you don't ask any questions, we're going to end up with a bunch of time at the end, and God only knows what you might have to see me do. I'll go break out the ukulele and sing, you know, Tiptoe Through the Tulips or something. All right, everybody that knows what that is, you just aged yourself. So, okay, so anyway, I know you all laughed at that. I'm just, you know, whatever you got to tell yourself, Bob. Okay, so in tip 41 also, they suggest these different group models that I just want to run through here for you real quickly, excuse me. So there's, I don't need to read these to you, you can read yourself, but let me just run through them. So the first is psychoeducational groups, which basically teach about substance use. This is where they learn, you know, about the disease model. They learn about tools of recovery. They learn about defenses. They, you know, they learn about, you know, working a self-help program. You know, what sponsorship and, you know, all that great stuff that we teach them. The relapse prevention. The, you know, how to cope with emotion. All this stuff, right? And this is really a hugely important basis of what we do. And we'll talk a little bit more about this in a minute. But we need to make sure that our clients are receiving the information, that they are attentive to it, and they are their retention level is high. And then also, you know, maybe demonstrate that they have retained the information. Everybody has different learning levels and different learning skills, and so, you know, we need to pay attention to that as we're providing this service. Okay, so the next one is skills development, and this is basically the tools that they're learning in these psychoeducational groups. These skills development groups is really where they can apply these skills to daily living, so that they can basically live life and have problem-solving skills and relapse prevention skills, so they can get through life and get through uncomfortable stuff without drinking and using. And then there's what they call cognitive behavioral groups, is, you know, where, you know, where we use our CBT skills, and this helps people, you know, take a look at their thinking and dysfunctional thinking and maybe erratic thinking or presumptive thinking, and really getting people to, you know, maybe start painting a different picture about things, and getting them to, like, you know, challenge their negative thoughts in a way that will enable them to actually change their behaviors. And it's really interesting because many of you know that I really like the Gorski model of relapse prevention and have taught it for years, both in my groups and to professionals. And you know, when I first started in this profession, and you know, and doing the Gorski model work, I really didn't know I was doing CBT, you know. And then I went back to school, you know, got my degree in psychology. I was like, oh wow, I'm doing cognitive behavioral therapy, you know. So that's very valuable, and these CBT groups, you know, are hugely important. And then there's support groups, and this is really, you know, kind of a peer-centered group where this is where the coping with emotion stuff happens. This is where, you know, they get to challenge each other and support each other at the same time, and this is where they can learn that they can actually feel and experience uncomfortable emotion with the support of their sober support system. And then finally, the other group model that they suggest is this interpersonal process group psychotherapy, sometimes called interpersonal process or therapy groups. And this enables clients to recreate their past in the here and now group and rethink relational other life problems they previously fled by using substances. Okay. Yeah, you guessed it. This is beyond our scope of practice. We don't do this, okay? So They go on to say in this tip 41 that treatment providers routinely use the first four of those models and various combinations of them. And the last is not widely used, chiefly because of the extensive training required to lead such groups. So, excuse me, if you notice here, so I have shaded out the interpersonal process groups, and that leaves us to four. And I want to just suggest that a way of grouping these together, you might have listened to my little running through these different types of groups. It's like, wait, I do that one. Oh, I do that one too. I do that one all in one group. Okay, so I get it. And we should on some level, but I want to just separate out a little bit. I stressed the importance of the psychoeducational groups, and I put that separate, okay? That is where we are educating our clients on addiction and how to get sober, right? And so, and now, although there will be some overlap if done correctly with the skills development groups, because as we're teaching the information, we really want to be able to make sure that they've retained it and even maybe give them the practice of using some of the stuff that we're teaching them, okay? But generally, I'm putting psychoeducational outside of this group. And then the other three, I suggest that those are done together. That those are what our group process groups look like, where we're doing skills development, where we're helping them to apply what they've learned in those psychoeducational groups and learning how to apply the tools of recovery into daily living, the cognitive behavioral stuff, which is again so good for the relapse prevention, and then and changing thoughts and therefore changing behaviors, and then the support groups where we really teach the clients how to really be there for each other and share what's going on with them and creating a safe environment and being able to get positive and supportive feedback from their peers and sitting in their pain with them and really a real bonding that happens. So I think all three of those are grouped together. So before I get into those, because that's really what this talk is going to be about, is those group process sessions, is I want to talk a little bit more about the psychoeducational groups. And in the psychoeducational, I've actually brought along a friend of mine, a new friend of mine, Tom Carl, who I met at the CCAP conference in San Diego a few weeks ago. And Pete Nielsen, the CCAP president, actually purposely put us together. He thought we'd do well and exchange information. So my exhibit table was right next to him. And we did a lot of sharing. And it was really valuable for me because he had a really, what I considered to be unique and very valuable way of doing the psychoeducational groups. And when I say unique, I say that because I don't think a lot of people do and structure groups the way that he is suggesting to structure them. And so what I've asked him to do is he's joined us on the webinar, and I don't have a video of him, but I'm going to activate his microphone right now so that he can talk to us a little bit about psychoeducational groups. And by the way, he's going to talk to you about the different kinds of learning, the different aspects of learning that you can actually measure. And he actually created these like discovery cards, which actually really address these different measures of learning. And I hope maybe you'll visit his website later just to see what he's got, because it's really, really good stuff. So here, I'm going to activate Tom's microphone right now. And there we go. Okay, everybody, please.
There we are.
Tom Carl. Are you there?
Hey, I am, Bob, and thank you for the wonderful, warm introduction. And yeah, we have become new friends since that. And I just loved what you shared about, how you broke, you separated the psychoeducation from the other three. And I'll be honest with you, as I've traveled around to lots and lots of treatment centers, I'm so happy you're doing that, because people even throw that into the mix. And that becomes part of just the group itself, and they're trying to do psychoeducation in that group with everything else. And I love the way you're putting it aside. And that's what that's what we've been trying the message that we're gonna, we've been trying to make. And I really appreciate you having me come on here. So I'm Tom Carl. I'm with a company called R1 Learning, and we're really focused on what Bob says, that psychoeducational component of the behavioral health field. I'm not going to go into much more about R1. If you want to do that, hit our website, and Bob will give you that as part of the session here. But we come at this thing from that people in recovery and that are dealing with their addictions are really learners in a new subject matter. And so that's how we're approaching this thing is the better we can do psychoeducation, the more that we can help people learn these concepts, learn these topics, learn about relapse triggers, learn about defense mechanisms, how do you build healthy boundaries, the stages of change, all those topics that we teach, the more vocabulary that we can help them build. Words, it's about words and vocabulary, the more informed they are and the better they are going to be able to bring themselves to that process group. They're going to be able to bring themselves to the one-on-one counseling, and everybody's going to be much more effective as a result if we do the psychoeducation well. So that's what Bob's invited me to talk about. And I'm going to share we're going to jump in here fast. We're going to share we're going to touch on 3 ideas. And how do you create dynamic and engaging psychoeducation? And the first one really is what are you trying to do? What are some of the things that you might want to measure when you're doing psychoeducation? And you can see some of them on the screen here. And, what they beg the question of is what are we trying to accomplish in that session? So, what are the objectives when you walk into that room, or if you're managing other counselors, when they walk in the room, what's the goal when the session's over in 45 or 50 minutes? A good one that I think we can get our heads around is learning comprehension, right? So what do we want people to learn? And people process information differently. And maybe we're teaching today phases of addiction, Jellinek curve. At the end of the session, do you want them to know who Elvin Jellinek is and Max Glatt? Is that part of what you want people to walk away with? Do you want them to know the 5 phases? Do you want them to know, that there's, the progressive phase and the chronic and the crucial phase and the recovery phase? And can they name them? Can they explain them to others? Can they relate them to their own story and their own experience? So, what are you trying to accomplish in the learning itself? And so that's a question we beg you to think about as you're designing your own learning sessions. And simple stuff. Are you testing for it? Are you giving pop quizzes? What would be the benefit of that? Why wouldn't you do that? Do you do that now? Engagement. You'll see that at the front of the list. It's there for a reason. For us, it's the doorway. It's the gateway to learning, because as you all know, you've been running groups or in groups, running them. And, unless people are present mentally, not just physically, but they're really present and you're reaching them through the way that they learn. And we're going to talk about that in a second. They can't learn at all. They just won't be able to get the information. So it's really critical that, how we engage them, how we get them to participate, is just an important fact. What we're going to do is we're going to touch on 2 ways to do that. We're going to hit 2 basic ways to do that. And one is just how you structure in your room. How do you set it up? And as we move around, as I see lots of treatment centers, I'm still going into lots that just have rooms set up for process group, right? You all have been there. 12, here's our diagram, 12 chairs, in a circle, no barriers. That's a therapeutic, kind of setting. The counselors at one of those seats. If you're really going to build a dynamic learning environment, it looks like a classroom. We've all been in a classroom before. And so how can we create that environment for our psychoeducation? And you see it's basically set up to where, it's you got a monitor in front of the room, you got flip charts, you got tables, you got people, so you can set up really active learning. And you'll even see in the diagram here, Bob and I talked about this, is, hey, the counselor is in the center. We're not even in front of the room doing lecture. That is one way to get people to learn, but it's really, you're in the center facilitating really good learning. And if you do that well, you can set up activities at tables. You can ask questions for people to work on. Today we're going to work on somebody's relapse plan at this table. And what happens when you do that is you can get more people to share. You can ask people to pair and share. And when you do that, you'll actually see that very quickly you can go from having potentially even 6 times the amount of engagement. Bob, if you hit the next slide, you'll all see that, even with just the way you set it up, and you get people to answer a question and ask them to pair up, you're going to have 6 people sharing in the room versus just 1. So structure, I want you to think about that. Think about your own settings. At CCAP, when we ask this question, how many of you have rooms that are set up for that kind of a setting? I'll tell you, 1 in 10 people raised their hand. They didn't have tables. They didn't have a room like that. Critical. The last piece we're going to talk around is, okay, you got an environment like that. How do you get people to process information? And one of those things is, well, how do you design your learning modules? And one thing that Bob wanted me to just share with you is this idea of, designing your learning for different learning styles. And the next slide is really about that. Are you designing modules that really allow the learning to learn the way that they learn best? Visual learners learn by seeing. They like to see models and photos. They like DVDs. They like videos. They like to process that information. So do auditory learners. Verbal learners like to talk. They want to present. They actually want to also write. They want to capture things. Physical learners move around. Logical learners like to problem solve. They like to know backgrounds on theories. So as you think about your learning modules that you have for, when you talk about defense mechanisms or stages of change, are you doing it in a way where you're getting people to do active learning? Are you doing it in a way where you can address these different learning styles? So, in a nutshell today, we're just touching on, how you can get some of these best practices in there. What are your learning metrics? How's the room set up? Are you hitting different learning styles? I really appreciate Bob having me come on. And Bob, jump in. Any other thoughts on this piece?
Yeah, Tom, thanks so much. I really appreciate the fact that I feel like you've maybe created a template for us all to really increase the efficacy of our psychoeducational groups. And there's much more to learn. You've really, you just really scratched the surface. And this setup that Tom is suggesting here, look, this isn't a plug for Tom's product. I wanted to bring him in here because this is such an important part, and he won't do it himself. So I'm going to. He's got these discovery cards that are just fabulous. He's put a lot of time into it with a super broad base of information. And so he's got these little decks of cards that are, stages of change, relapse, defense mechanisms, all kinds of different topics that can be utilized, with this kind of setup. And the way that they're used, it really addresses those different learning objectives and different learning measures. So I encourage you guys to go to his website and take a look at that stuff and maybe try them out, because it's super, super good information. Tom, thanks so much, man. Here's Tom's information. You guys probably noticed that I did upload the slides here. It should be down toward the bottom of your little panel on the right-hand side of your screen. So you do have this information. Tom, thanks so much, man. I look forward to the next
Bob.
time I see you. And Tom and I are actually thinking about maybe doing something together at a conference, doing a talk, or maybe we'll get deeper into this, maybe in a more advanced level. So Tom, thanks, man. I appreciate you. Are you still there?
Yeah, thanks, Bob. I wasn't sure if you turned me off or not, but
Okay.
Absolutely, and thanks for letting me come on here today.
All right, man. Take care. I'm going to mute you now.
Okay, good deal. Thanks a lot, guys.
Okay, bye-bye. Okay, I hope you guys found that useful. Great guy, good information. So anyway, so now let's talk about, so that was the psychoeducational. Now let's talk about the other three things combined and how we structure that. And Tom had a great little diagram right there of what a circle group should look like. You notice that it was balanced. In some of the groups that I've been to, in some of the, actually I just saw a hand and then it just disappeared. In some of the groups that there it is. Before I get into this, so let me see if, okay, we're going to see if this works. So Todd, looks like you have a question. Go ahead, man. Todd, can you hear me? Well, maybe your microphone's not working. Go ahead and type it in, man, okay? Okay, and now, so, I've gone to groups like, I'll go into the room and it might be like a square room and you got chairs along this wall, chairs along this wall, chairs along that wall, and here. And sometimes it's a really big room, so they're really far apart. in order, so you can see people over here, but anybody that's like next, you kind of got to lean forward to see them. And it's just not a really good setup. It's not intimate. It's not, it doesn't have a close, feeling to it. And it's not, that functional. I've also walked into rooms where there's like this half moon of people, and the counselor seat is like at the forefront, right? So it's everybody in this half moon around the counselor. And so the counselor is the focal point. The counselor shouldn't be the focal point of a process group, right? We want to position the counselor right along with the rest of them in a circle like Tom has shown, and that person is just one of another person in that circle, and it's balanced, and the counselor is not separate. There's really a real good therapeutic value to this as well, not only logistically and being able to, like, everybody can interact easily and not separating out the counselor, but having everybody kind of up close that way. It is kind of uncomfortable sometimes. Heck, it's uncomfortable for me sometimes still. If I go to a meeting and it's set up like that, because there's no barriers and everybody's like right there. But it's important as we get our clients used to interaction and used to building relationships and used to intimacy. It supports that, and we want to support that. We want them to be comfortable in that, and once they do that for a little while, they do eventually get comfortable with it, and that lends to building sober support and being able to feel more comfortable in sharing. So then I very strongly suggest that let's see, seems like Todd, are you there now?
Yeah, can you hear me?
I can now, yes. Go ahead and ask your question.
All right. Yeah. Thanks. I just thinking to the group that I had last evening, which is so often the case, especially as a group gets larger, people, between the fact that they'll be absent or new to the group or relapsing and kind of in a relapse track separately and then coming and going, end up with almost having to keep reforming the group kind of in those group stages of, forming, storming, and then cohesion of the group. And like the whole group was just so, they were not trusting of the group setting last night. It was kind of evident that there were newer members, and just the way that the group changes like that, it was really like pulling teeth to try to draw them out because of the way the group changes, and people finish when other people are, what I'm saying.
Yeah, absolutely, Tom. Thanks so much for your question. So this is a huge point that you're making, and it's actually very timely that you're asking this question. So in talking about structuring the group, so I want to start by just saying that I have spent most of my career in the private sector where groups were at a manageable size, and like, an IOP setting where, if the group gets too big, then we split it up, and you've got like the same people, pretty much, you've got people that are, kind of graduating out, if you will, and new people coming in, but there's the basis, the nucleus of the group is kind of staying together, with some people dropping off the back end and other people, coming in. And so sometimes, you have a real cohesive group that's been together for a while, and you've structured the group for them. They know what's expected, and they're really a good functional group. And I'm going to get into that structuring piece in a minute. But then sometimes, you might have a lot of people that are graduating together and a bunch of new people where you need to restructure. And so what I'm hearing you say is that it's kind of, that issue, but bigger, in that you've got a much bigger group, and you have more new people to the group very, very often. I will tell you that my experience in the public sector is that although it's changing now with some of this Medi-Cal waiver, and they're actually the counties that are involved in this organized delivery system that they're requiring the groups not to be any more than 12. But even with that, I've seen where there's so many different groups and there's so many different services. So they might be providing outpatient treatment, IOP treatment. They might have domestic violence groups and anger management groups and parenting groups and all this stuff. And so it's really super hard to develop a continuity, which Todd was talking about. And we want to do our best at developing that continuity. So my recommendation is, and if there's any managers, which I think there are here listening, is we want to figure out what is the best way that we can have the same people going to the same groups. And so, let's say you've got, I don't know, let's just say you've got 50 people in your outpatient or IOP groups. I just suggest that you do different tracks. So you got this group of people that are going to the same groups together. This group of people that are going to the same groups together. This group, and so on. So you got like maybe 4 different groups, and they're all, they can expect when they're showing up to their groups that most of those same people are going to be in there. And in that way, we can develop these bonds that we were talking about. Because lack of continuity really does hurt our ability to do much of what we talked about kind of in the intro part of this talk. So we want to figure out how to get the same people in the same groups, and by the way, with the same counselor. The other piece about this, with these folks going to all these different groups, not only are the group members different, but they have a different counselor every group, right? So there's like no continuity. So they might do some real down and dirty group in a certain area, and maybe the next day they're in with a different counselor, and if that counselor somehow didn't get and see what happened in that previous group, it's almost like they got to start over. So we need to structure our programs, if at all possible, in a way where we have the same people going to groups with the same counselor as much as possible. And if it's not like that, I get it. And I know that, we do stuff in a certain way for quite a while, but I just want to challenge that and see if we can really get out of that, and really, based on some of what we're talking about today, really see the need to structure our groups in a way that we can develop that continuity. So thanks, Todd, for that question. And so let's go into what the actual structuring looks like. Okay, so first off is group rules. So I really think that the group rules should be read before every group. I actually like the idea of having them posted on a wall on a big poster. So it's reviewed in every group. And again, so if you've got a new group with a lot of new members that haven't been together, we just read the whole thing. You can have one member read them all, or you can go around the room and they can take turns. If it's a more mature group that's been together for a little while, and they all, you get that they kind of know all the group rules, you can get a little creative where you can involve the group members, like, okay, Susie, give me a group rule. George, give me a group rule, and just go around and, okay, who else has got another one? Who else has another one? This is also a good way to actually disengage clients by calling on them in that way. And so then, they'll come up with most of them. And if there's any of them that are like hugely important that they haven't come up with, like, confidentiality, then we can chime in with that. Okay. And then what's really important is enforcing the group rules. A lot of times we'll do the group rules, and I'll I'm doing this group evaluation, and they just did the group rules, and like somebody breaks out a pack of chips, and the rule that was just read is no eating in group, right? And so you got all this crinkling, and people are hungry, and it's like, it's just totally distracting. So group rules are read, but they're sometimes not enforced. And there's just a couple of group rules that are I think super important, that I want you to pay attention. And this is, we all get confidentiality and that, but one that I really want to emphasize, and this is not only a group rule, but this is kind of like a counselor group rule, is be on time. What time does a 10 o'clock group start anyway? I think it's 10 o'clock, but I will tell you, over 50% of the group evaluations that I have done, groups do not start on time. 5 after, 10 after. And so if group members know that groups start at 5 or 10 after, what time are they going to show up? 5 or 10 after, if you're lucky. And then there'll be 5 minutes late for that. And it's just this dynamic just keeps going. And, pretty soon you've got, people showing up at all kinds of different times. This is not good for many reasons, one of which is alcoholics and addicts don't have very good structure, right? Their lives are very unstructured, and we want to help them structure their lives and create some continuity in their lives. And this is a real opportunity for us to model what structure looks like. So if there's a 10 o'clock meeting, it starts at 10 o'clock, and we just do that. And if it ends at 11:30, then it should end at 11:30. But I'm sure you're like, oh, well, what if somebody brings up, this like really sensitive issue, with 5 or 10 minutes left in the group? Well, stop them. Okay. We don't have time to do this. And so it might look something like this. Hey, Lisa, check it out. What you're talking about right now is hugely important, and we really need to spend some time on this and give this the focus that it needs. But we're 5 or 10 minutes from the group, and we can't possibly give this what it needs. So I'm really glad that you took the risk of bringing this up. I'm really glad that you've done this. So let's make it a point in our next group to really process this. And we have 5 or 10 minutes here. So I just want to maybe just put out, maybe I'll just put out to the rest of you. Is anybody else like dealt with stuff like this? And maybe have somebody else share 5 or 10, and then so that we're putting ourselves in a position to really be able to end the group in that 5 or 10 minutes. So it ends right on time. And then it also trains the group, like, don't bring up heavy duty stuff at 5 or 10 minutes, toward the end of group. That's really going to need that kind of processing. Okay, so that's really important. Oh, and then the other thing is that these groups are really important, aren't they? In fact, they can be life and death. I mean, the work that we do, and maybe I'll get on a little soapbox right now, but I don't care. The work that we do is hugely important, and we're trained professionals treating a life-threatening disease. When people don't get this, they die. They end up in prison. They end up with huge health issues. They're isolated. Some of them end up in the streets. This is hugely important work that they're doing. And there's some of us who've really, tried to get licensure in this state, back years ago. We've gotten some licensure bills to the governor's desk, who like vetoed it, which is very unfortunate. And so a lot of people don't really see what we do as being professional. It was kind of a statement by the government that said, no, you're still paraprofessionals. And that's really unfortunate. But I just really want to encourage all of you to hold yourself up as a professional and stop using the term field as referring to what we do. Field is where cows go doo-doo, I like to say, right? Refer to us as a professional. We're every bit as professional as the other disciplines, that are called professions. And what we do is hugely important. So, okay, off the soapbox. So if these groups are so doggone important, what message are we giving the clients if we start our groups at 10:10 rather than 10 o'clock? Yeah, the statement is that this isn't important enough to start at 10 o'clock, right? And so we want to start them at 10 o'clock and stress the importance of these groups. The next thing is no walking out. And this, I'll tell you, I used to enforce this stronger than I used to, but kind of got a little pushback from folks that are reminding me about, trauma-informed care. And, there are times where if something's going on in the group and somebody's trauma is activated, they may really need to get up and leave. I get it. And so we want to allow for that. But I'm talking about routine walking out. I'm talking about getting up and using the restroom. I'm talking about getting up and going and grabbing, a bite, or coming, I've had people get up, they're gone for 10 minutes, they come back, and you can smell they actually just went out to go smoke a cigarette. Are you kidding me? They interrupted our group, for that. So I want to encourage you to treat your group as being sacred. This shouldn't get interrupted by anything. We want to protect your group and your group members from any possible distraction, including people getting up and going to the restroom. including a therapist coming into and interrupting the group and pulling somebody out of group. There's just no way that should happen, you guys. And I get it, it's inconvenient and it's convenient for them to do that, but doggone it, I'd be pushing back on that pretty hard. And if you are a therapist, just be aware that you're really interrupting a very important dynamic in there. And if somebody's getting up in the middle of somebody's share, I mean, gosh, what message does that provide? It's, hey man, I sat here through your stuff, you can't sit here through mine. Or a lot of our folks really have had a lot of neglect and really being talked down or made to feel like they're not important. And when you get up in the middle of somebody's doing work, that reinforces that message that what they're talking about isn't important, and we don't want to give that message, right? So we want to avoid walking out if at all possible. There are issues too. Maybe somebody's got like prostate issues, or maybe somebody's taking diuretics, or maybe some other sort of issue. We do allow for that, but we really want to train people. You go to the restroom before group, so we don't have to interrupt it. So we want to just keep all of that to a real minimum. And then, going back to the being on time thing, there's just one more thing that I wanted to mention about that. If somebody is able to show up late and nobody like brings it up or calls it out, it's really easy to show up late again. So I'm not talking about like confronting them heavily or anything, in front of the group, but in a supportive way, or a kind way, if you will. It's like, hey Bob, you were late to group today. What happened? And then they're going to need to give an explanation. And if they're late for group, that they're going to need to provide an explanation in front of everybody, and this is noticed and called out, it's just harder for Bob to be late next time, right? So we want to call that out, and then when they give their excuse, like, okay, well, it's really important to be on time, because when you come in, it really does disrupt the group. Okay. And so we really want to have no interruptions. As far as the no food or drink, I used to not even allow water in groups. I was really strict about it. I do actually allow that now. Some people allow coffee. I'm not feeling that. And even the water just bugs me a little bit. And I do kind of let my group know that, you bring water, but just be aware of your tendency when things get uncomfortable is to break that tension by grabbing your bottle of water and having a drink. It pulls the person from their uncomfortable emotions, and in fact it can actually draw other people to what you're doing, and that still is an interruption in the group. If there's no food, let's just say you wanted to bring, I don't know, Danish or something like that one day. Well, you say, okay, our group rule is no food, but today is a special day, and we're going to go ahead and do this. So you're not just ignoring the group rules. You are still acknowledging them. Okay. So then another part of structuring the group, and I'm going to actually in a minute get into how what we convey to the clients into where we want our group to get to, and this will help as I'm explaining that. So a feeling round. I really like starting groups with a feeling round, and because when our members come to group, they're very often in their heads, right? And as I've mentioned earlier, it's really the feeling, the emotional part of group is so important. I just like starting it out with pulling them out of their head and getting them to really take a look at how they feel. Some people just have no clue about that and have never really looked at that. And so this is hard for some people. I will tell you that I don't good, fine, okay, and great. They don't fly, and I let the group know that. And if they're struggling, we can help them with a feeling chart, which I'll give you an example of that in a second. And so, it's basically introduce themselves. Everybody has their own way of doing it. You can say, you can introduce yourself, and if you have a disease, you can go ahead and call that out, and then give 2 feeling words with no explanation of the feeling, just the feeling words. And then if you want to claim some time, you can go ahead and claim some time during the feeling round, and then I'll know that you want to do some work. Okay. And so as far as so they might be thinking about their feelings and they just have no clue, about their feelings. They might need a little bit of help. And so a feeling chart such as this, I just use the emoticon version. There's a lot of feeling words there, and just have them go through the list. And there's no hurry. You let them, have a look and have them grab onto one or two of those. There's another one here that I especially like, which is expressions of Vader, and this has the different feelings and the expressions, and that works really well too. So you notice it's like the same expression, everyone. Okay, you all gave this big heavy laugh. I get it. All right, yeah. By the way. So okay, so then if you have a group they're just so out of touch with their feelings, and they're just really not sharing, and you want to do maybe a different opening than a feeling round, because that doesn't seem to be working real well. A topical opening is another option in lieu of the feeling round. And so what you do is you basically bring up a topic in the form of a question, and then we just go around the room, and I like the introduction, so everybody kind of gets to know each other, and then everybody one by one answers the question. And then from there, the direction of the group can be guided. And there's always stuff that comes up in a direction that you can go in that way. And it's just a way to really, get the group started, get them engaged. And then from there, we get the direction of group. I'm going to tell you how the feeling round direction is in just a second. But this, for example, it could be like, what are you going to do for recovery this week? What is your biggest barrier to getting sober? What is the hardest feeling for you to feel? Or what is the feeling you mostly use over? What's the most difficult part of sharing in the group? What do you value in life? It could be any number of things, and you'll have your favorites that you use. That's just some examples of some, and it really takes the group in a direction for you. So then, okay, so now here's the part where what I really call restructuring. Okay, so it's done initially and then at different points in time. And Todd had mentioned earlier about, actually, before I go into that, I have a question here. And I am going to go to Roberto and connect his audio. Roberto, can you let's have your question. Hi. Okay, that doesn't look like he's got a mic activated, so it looks like he actually asked the question over here. So, how do you politely let a patient know that they're sharing a little too long? We are going to get into that. That's an excellent question, Roberto. And when we talk about the counselor's role, I'll get into that, okay? So let's get into the actual group mechanics and what we talk about to the clients about where we want the group to get to. So the first thing that I let them know is that this is your group. This is not my group. Notice I'm just part of this circle, and I'm not the focal point. This is your group. And really where I'd like you guys to get to is where my role is very minimal, and I just watch you guys go. That's where I'd really like to get the group to go to. It'll take a little bit more of my involvement to get it to that place, but eventually you can get there, and I know you will. And so here's how our groups are going to go. We're first going to start with the group rules in every group in some form, and then we'll typically start with a feeling round. And during the feeling round, we go around the room and introduce ourselves, and we come up with just 2 feeling words. And then during the feeling round, you're able to go ahead and claim some time. And when you claim time, then I make sure and get to you in the group. Okay. And so once the feeling round is done, then we actually go into the sharing portion of the group. So if you have claimed some time, just go ahead and start and share. And then my job is to just kind of keep the group going in a direction and keeping it focused and keeping us moving along. And so you might be sharing, and it might be getting maybe off topic, or or it might be going a little long, and I know that there's other things that we need to do in the group. So I might stop you and just to refocus you and just be really clear that I'm doing this not because I don't want to hear what you have to hear, nor am I doing it because what you say is not important. It's just that my job is to keep the group moving, and that's the focus. And there's certain things that I see in the group that will want me to move the group along. So that's what I'm doing there. So Roberto, that's the part that we address, is that so when I do that, I'm really creating an avenue for myself, right? So given that I have told them ahead of time that I'm interrupting them, or that I'm refocusing them, not because what they say isn't important, not because I don't want to hear it, not because it's maybe boring or whatever, because that's the message that they get sometimes when they're interrupted. It's like it's like we tap into their trauma. But when I do this ahead of time and let them know I'm going to do it, it lessens the chances that they're going to feel that. And if they do feel that, maybe it's not so hard. And so I hope that answers your question. And so I'm going to get to another question in just a second. And then so I let the group know. So then we're going to go into the share portion of group. Okay, and then once the sharing's done, then what I'll do is if it needs to come to an end, I'll have you wrap up, and then you wrap up, and then what I'll do is ask, is there any quick clarifying questions before we go to the feedback? And then that allows anybody to ask clarifying questions, and that's the only time that the person can actually respond, because during feedback time we don't have the person respond, and that's like really important. So we ask any quick clarifying questions. I don't really give it too long, because I really want to move it to feedback, but I do give that opportunity, and then we go into feedback. And when the feedback happens, we just want to make sure that it's supportive and loving, and even if we are maybe confronting something or wanting to get them to see something, we do it in a very caring, non-judgmental manner. And me as the counselor, I will model that for you, so you kind of get to know what that looks like. So I will have more participation in the early parts of the group until you guys kind of catch on to that. And the person receiving the feedback does not say anything, and it's really uncomfortable. And yeah, I get it, and it's important that you feel that discomfort. So if you're just responding to every time somebody is giving the feedback, then you're not really receiving the feedback. You're just pushing it back because it's so uncomfortable. You're not even like giving it a chance. You're just pushing it back. And so, you can just be pushing back and not really receiving anybody's feedback. So we want you to really receive the feedback, and B, deal with and feel the uncomfortability, because we use over that uncomfortable feeling, and we really want you to learn that you can feel it without drinking and using, with the help of your sober support. And at the end, if you're just like freaking out or chomping at the bit, like you just have to share something, I may or may not allow you to do that. But if I don't, you'll actually know why. So it looks like we have another question here. So let me go to that. So do all the same rules apply for family group, where family attend with clients? So when you say all the same rules, group rules, yeah, group rules, I think would be the same for family group. I don't know. I haven't really thought too much about that. There may be some extra rules depending on what you're doing in your family groups that you might want to add. I don't know if you want to ask more specifically some of the rules that you have in mind. So yeah. And then so in going on with the structuring of the group, and then I'll let them know that and so then when I think that it's time for the group to move on, I will wrap up the feedback. Some of you might have your hand raised. Again, it's not because I don't want to hear what you have to say. It's not what you have to. It's not like what you have to say is not important. It's just that I need to move the group along. Okay, and again, that allows me to do that, and it kind of gives me permission to do that, if you will, and it frees me up, because sometimes it's hard for me to do that. Sometimes I get a little codependent, and I want to let that feedback go on longer because I don't want to hurt somebody's feelings. Well, ahead of time, I let them know I'm going to do that, and it empowers me as the counselor to be able to do that. And so then, and I'll let them know. So, I might do a little wrap up, or maybe, bring up some feedback that I thought was particularly, that I feel like I really want the person to, that I want to emphasize, or that I want the person to hear. I might, and then now I'm speaking to you, my audience. We also want to bring up some positive, like good job sharing, and really providing encouragement and good work and stuff like that, which I think I'll talk a little bit more about later. So the bottom line is, now I'm back to talking to the clients in the group. So my role becomes minimal. So when this group really gets pumping, and when I say pumping, I mean you're pretty much self-operating, with me just doing those things like moving us along, when he needs to move along, and asking the clarifying questions, and stopping the feedback when we need to stop the feedback. That's all done. And then what happens is eventually, I'll be providing more feedback in the beginning than I normally would. But after a while, I want you guys providing the feedback. In fact, this group might go silent because I know you're capable of providing the feedback, and I'm just going to allow you to do that. And I might even say to them that my job is working myself out of a job with you. And so if I'm just giving you like all the answers, then I'm kind of stunting the growth of the group. And so that's kind of what this restructuring process looks like, and how I do that with the group. And so if I have a newer group, I do that, and then maybe my group matures, and the group's really pumping on all cylinders and really self-operating. But then I get a slew of new people. I do that restructuring again. So then, and now in regards to the counselor role, excuse me. So the feeling round educates the counselor on who to make time for in the group based on who claimed time. So during the feeling round, when they claim time, I'm making a mental note of people that claim time. So I know I want to get to all those people. And then through counselor observation, so during the feeling round, I might notice that somebody looks really uncomfortable, or maybe they shared some uncomfortable feelings and they didn't claim time, and I think maybe they need to get in. And so I'll make a mental note of those. And then also, if maybe there's somebody who hasn't shared in a while and I want them to get in, I might make a mental note that I want to call on them as well. So now, as a result of the feeling round, I kind of have a clue of how many people I really want work to get done, who I'm going to give some time to here in this group. And then what happens is I manage the time sharing segments accordingly. So if I've maybe identified 5 people in the group that I want to make sure to get to, I'm moving the group along at a pace to make sure that I'm allowing me to get to all 5 of those people. Hope that makes sense. And then the counselor wraps up each segment with a summary statement, as I said earlier, maybe summarizing some of the more poignant feedback, and then providing positive supportive feedback. Good work. That's really great. Thanks for taking that risk with us here in group. That must have been very difficult. That must be very hard feeling that. So that kind of thing. So we want to reinforce vulnerability. Whereas remember, a lot of our folks, they haven't been able to get vulnerable, maybe in their upbringing that has been taken advantage of to get vulnerable, or maybe, sharing, sharing their innermost stuff is not received well. And so we want to feed that. We want to welcome that. We want to give them positive reinforcement. And for some of our folks, they've never really gotten that before. So, and then another part of the counselor role is that we want to encourage disengaged clients to participate. So even if maybe we haven't identified them as doing work, like maybe we think that might be a little, maybe they're really super new and it's like the first week, we may decide to, go ahead and call on them to share or whatever, but maybe we're just thinking maybe it's better for this particular person to ease into it. So maybe during feedback, I might say, Hey Dave, do you have any feedback for such and such in regards to this? Or has this ever happened, with you or whatever? Just as an opportunity, just get their lips moving and get them, used to start sharing. They may not have much, but at least we've, given them that opportunity. And then, we're artists and we help to, we try to draw people out the best we can. I will tell you that I have I created a group evaluation tool that has about, I think, 23 different items on it. It's very extensive and it's a great tool. I do that kind of thing, consulting, if you ever want me to come in and do that. But I'll tell you that engaging disengaged clients is one of the top failures of counselors in groups that I've evaluated. There's a lot of people who they just look totally disengaged and they never say anything, and nobody ever, and the attention has never drawn toward them, and they really haven't really participated. They've just been kind of a body sitting in there. And so it's really important to just check in with, hey, you're kind of quiet today. Just wanted to check in with you. How are things going? They might give a good, fine grade or okay. All right, so is this group going okay for you? How did this topic grab you or whatever? Just, doing what we do to try to get them engaged. Okay. So this might seem radical to you, but where I want to see the group get to, for me, is I'm talking about 10% of the time, right? That's a pretty low percentage, isn't it? But I think if it's really if really my role is to simply move the group along when it needs to get moved along, give them an opportunity for the clarifying questions, let them know when the feedback is going, and then the wrap up and move it along to the next person. If that's truly all my role is, I shouldn't be talking more than 10% of the time. The thing about the quick questions, you can take that or leave it. I just found that it's useful. But some people would just go, it's the sharing and then, straight to the feedback. And that sometimes is a little bit cleaner, and it provides the less of a role for me, because sometimes I might not even need it to go. I might not even need to move it along to feedback, that somebody shares, they wrapped it up, and now somebody is ready for the feedback. And I can, sometimes I just, sometimes I'll just watch that go. So here's something that's really important. We always want to give the client the first shot at feedback. I'm going to give you an exception to this a little bit later, but we don't want to give the first feedback. And this is really hard, especially for folks who might be new to the profession. They've done all that training, they've done their internship, now they're running their group, and they just can't wait to prove to themselves and to others that they know what they're doing, and they're very happy to be in this environment. Man, they're just chomping at the bit to really help folks with their their issues and stuff. And so a lot of times they don't really wait and give clients an opportunity to share. So I will say that we perhaps are stunting the growth of the group, as I think I might have mentioned earlier. We stunt the growth of the group by providing answers that they can provide themselves. In fact, we could even call it codependent too, doing stuff for people that they can do for themselves. So remember, we're trying to work ourselves out of a job with these folks. And so we need to allow them to develop problem-solving skills, to be able to, to function and utilize their tools without us giving them all the answers. And so sometimes the group needs to go silent, and just be okay with that, because they're problem solving, they're thinking, and that's a good thing. We want them to be thinking. So again, I'll give you an exception to this in a minute. And then remember, if you have a new group that's just not used to giving feedback, we might need to go ahead and give first feedback, just to get the group going and be modeling what appropriate feedback looks like. But when the group's functioning, man, back off and allow your group to be able to give the feedback. And again, if the feedback's off track or missing an important point, we can redirect. And again, let's just say there's a point that a direction you'd like the group to go to. I don't necessarily take them right to it. I will ask the question. I might say something like, so what do you guys think about, Barbara's ability to stay sober through something that's like so difficult, right? And so that's my attempt at trying to get them on the tools of recovery and bringing this issue to a person's ability to be sober. That's kind of a way for me to get them in a direction that I'd really like them to get to, or the one that I think is important. And along those lines, remember, the purpose of the group is learning to stay sober. So everything that's brought up in the group should eventually be tied back to the person's ability to be sober. I've been to groups where some really good work has been done in there, but I couldn't tell it was a chemical dependence group, because nobody ever talked about working the tools of recovery, going to meetings, making phone calls, doing their morning, routine, in recovery, or reaching out and making phone calls, or doing journaling, doing any of the things, any of the tools of recovery that we're teaching. And so we, as the counselor, we want to make sure it somehow gets connected to the ability to stay sober, because that's what we're doing here. And there's many different ways to do that, one of which I just exhibited. So that's really important. Let's make this a chemical dependence group. And then, so here you see, educate, educate, educate. Okay, that seems to go away from this idea of the 10% rule. I get it. But there, you guys, this might be an exception. There's just some times in groups where you just have a teachable moment that you just got to grab onto. And we can do that, right? So there might be something, somebody might be bringing up, triggers or something, and the group is just maybe really missing the point of what a trigger is. I might take the opportunity to go ahead and educate on that. Or it might be, the utilizing of a sober support system. So what I'll do is really let them know, okay, I know I told you guys my role is minimal, but here's an opportunity that I just want to take to educate you guys on something. And I'm gonna do this, and then we'll get back into doing what we normally do. Okay, and so let's see. I think I have answered all the questions so far. Being on time and leaving, etc. So Linda made a clarification on her question, or do the same rules apply for a family group? Absolutely, in regards to being on time and no leaving. Sometimes it is maybe difficult, somebody's coming straight from work and, they get stuck in traffic. Okay, we get it. But I'd still like to call it out and just say, hey, what happened? Oh, okay, well, all right, well, hopefully you can leave a little bit earlier next time. So glad you're here. And in regards to the no leaving, yeah, this is really important in family groups as well, because can be some really sensitive stuff that's going on in there. And I would really want to not have any distractions in the group. If there's a situation where maybe, I don't know, it's a childcare issue or something like that, those arrangements should be made ahead of time, so that everybody in the group knows at the start of the group that at some point the person's going to have to get up and leave. And so then whoever's sharing doesn't have to be hurt by that they knew this person was going to leave, and it's not about them. So I hope that helps to answer that question, Linda. So, all right, and then talk a little bit about this coping with emotions thing. So again, this is something that's near and dear to my heart. I just, if there's a number one thing in regards to staying sober, it's learning how to feel and experience uncomfortable emotion. I often say that, people sometimes think what group is about is, solving problems, that lead to the uncomfortable emotions, which eventually leads to using. And although that is part of and can be part of what we do, the whole purpose of it really is, more important than that problem solving is learning how to deal with and cope with the emotions associated with it. That's like another connection point to, like, somebody might be bringing up an issue that's really difficult for them, and we're all problem solving, and nothing about addiction has been and recovery has been brought up. So one of the ways for us to tie that in is man, that seems like a really difficult issue. What feelings are around that? Well, I got a lot of fear, about that. And then, have them, and then now you've gotten the group to be able to, talk about their, their fear, and or they might say, gosh, actually this issue really causes me just a lot of embarrassment and shame. Yeah, let's talk a little bit about that. What happens for you in this? And by the way, this is the another kind of exception to the clients always give the first feedback. When we're talking about emotions, I got to tell you guys, when it comes to emotions, I'm like Tigger. I pounce, right? When I see an emotion, that's where I go. And there's just nothing more important that can happen in the group. So if I can steer that, and now they're talking about shame, oh, great. Let's get this person talking about the shame. And so they talk about the shame, and then while they're doing that, I'm kind of observing the group to see if anybody else looks like they're really feeling it. And so, sometimes if they're getting emotional, somebody else might be, and then I'll go, what's happening to you over there, John? I noticed that you're kind of feeling over there. And then they'll get talking. And now the group is like really kind of, now you've got the people giving feedback and supporting them and sitting in their pain with them. And thanks so much for sharing and that, and trusting us with that information. And man, what courage it took to talk about all of that. And yeah, something similar like that happened to me. And so basically the group is just loving on them and validating them and sitting in their pain with them. And you see the person who was feeling and experiencing all that emotion just kind of like get through it. And their shoulders just kind of drop and they just feel okay. And so that process in itself is hugely important. But what's also important is that we are able to get the group, the person to see, do you realize what you just did? You just talked about stuff that was like really painful for you. This is the kind of stuff that you probably ended up using over and avoided by using alcohol and drugs. And here you brought it up in the group, you processed it, you felt it, you got support and love from your peers, and look at you, you actually look like you're doing good. So that should tell you that you do have the ability to feel and experience uncomfortable emotion, right? And how did you do that? Well, you did it with the help of your sober support system, right? That's why we want you going to those outside meetings, or when you get out of here, or if they're an IOP, that's why we're having you go to those outside meetings. That's why we're having you meet people and get phone numbers, so that when you're out of group and you get an uncomfortable feeling, what do? You just emulate what you did in group. You get an uncomfortable feeling, you dial up. You get with one of your sober support system or several of them, making a few calls, sharing with them what's going on with you. And getting that support and love and affection and the willingness to sit in your pain with you and your validation, right? And there's just nothing better. I got to tell you guys, I don't think there's any more important tool of recovery when somebody is feeling and experiencing uncomfortable emotion than getting on the phone with another alcoholic or addict. I just don't think there's anything more important. And it needs to be somebody who's in recovery, because people that aren't in recovery, they don't really get just how sensitive alcoholics and addicts are. They don't really get how intolerant of emotion alcoholics and addicts are. And people that aren't in recovery can't understand that why, despite all this evidence that I have that it's not a good idea for me to drink or use, how I can somehow make it sound like a good idea. Only another alcoholic and addict, outside of group in their sober support system can truly understand that. And if you've got a best buddy or a mom or somebody who's not like, or sibling that isn't in recovery, they can't truly understand what you're going through. That's why we need to build the sober support of people that are in recovery so they can truly understand what we're going through. So we show them that they're able to, experience that uncomfortable emotion. We let them know how they did it, and we let them know that, when you have uncomfortable emotions out there, that's why we're having you get those phone numbers so that you can dial up and do exactly what you did in here. And so you guys, these groups are the training ground for that process. Our groups are the training ground for people to feel and experience uncomfortable emotion, to discover that they have the ability to do that with the help of their sober support, right? And then be able to translate that out there into their environment. So just an overview of that is, we steer the group whenever we have the opportunity to processing and feeling uncomfortable emotion. And when they've done that and that process plays itself out, the counselor verbalizes their ability to experience that emotion. Look what you've just done without using, and how you did that with the help of sober support, and translating that for the group, translating what happened here in the group out there into their environment, and using the sober support to emulate just what they did here in the group. So finally, we got just a couple of minutes left here. Talk about Therapeutic Alliance. Actually, that match study that we talked about earlier, I have cited myself in the past, because one of the things that they came up with in that match study was that of the things that we have control over, because there's a lot of extra therapeutic factors that they bring to the party that we may not have much control over, but the things that we do have control over, like, you got that piece of the pie, the pie of things that we have control over, the biggest piece of that pie in regards to positive outcomes and how well clients do is affected by the Therapeutic Alliance. Our treatment theory, or how we go about things, that has really negligible impact compared to the impact of Therapeutic Alliance. It's my relationship with the client. It's my ability to connect with them. It's the trust I build with them. And I got to tell you, I really like what's happening in our profession, where people are going toward client-centered rather than program-centered, because the program, centered, it's like, okay, we do this and we do it well, and if you mold yourself into our program, you're going to get this. And we might even tell you what your goals should be. If you weren't using drugs, you wouldn't be going to jail and you wouldn't have these legal problems. So you probably ought to get sober, rather than asking the client what they want. What do you want to get out of this? Well, I don't want to go to jail. So that's your primary goal being here, is you just don't want to go to jail? It's not getting sober or anything? Yeah, that's my purpose. Okay, you know what? We can help you with that. So we're going to design this program for you. And if you're able to follow the direction in this program, I'm going to be able to write you this really kick butt letter so you don't have to go to jail. Sound good? So you see what I've done there? I've aligned with the client. I have come alongside them, right? And let them know that I'm on their team. Because if I impose my goals, any goals I might have for them, I align myself with the judge or the spouse or whoever else wants them to get into treatment. And finally, we talked a lot about the value of group sessions. I want to tell you that this does not mean we don't do one-on-one sessions. My recommendation is, if at all possible, we have at least one individual session with the client per week, because this really lends to the Therapeutic Alliance, that being able to develop that Therapeutic Alliance and getting them to know that I'm really interested in what they want, and I'm willing to hear what they have to say. I'm willing to sit in their pain with them, right? So we want that individual contact as well. So we're about at the end here. Wow, the timing worked out just about well, and I see no questions. So you guys, thanks so much. I hope you got a lot out of this. I hope this really helps you to have more efficient and effective groups, and learned a little bit more about your role in the group, and gain some additional tools. I know this is only an hour and a half, and we couldn't possibly talk about everything that needs to be talked about, but I hope this gives you a good base. So you're going to be automatically given a survey at the end of this. It'll just pop up for you. You're going to do the survey and the post test, and then based on the post test, when I go and get those, I will be emailing you all certificates. So thanks so much, and I'll email you with the next one of these live webinars that we're going to do, and I hope you'll be a regular participant in these. Thanks so much. God bless. Keep up the great work. And here's my website. You have this in your handout, so go and see what we're doing. I do educational DVDs, and I wrote a book, so check all that stuff out as well. All right, take care. Love you.